am Jisoo, and together with me, Christine Jean Abesa, Angel Mar Valencia, Janlyn Lim Huko, Trinaritz Elcano, and Michelle Michael. In this video, they will show you the ways to treat the sport injuries. So let's begin.
What are the causes of muscle strains? Participating in contact sports such as soccer, football, hockey, boxing, and wrestling can increase your risk of muscle strains. Certain parts of the body are most susceptible to strains during participation in certain sports. Examples include the shoulder, the hands, legs, and ankles. If you are asking if we can treat all of these, the answer is yes. There are various ways in how to treat those. First thing first, if this happens to you, you should have to find a place that you can relax yourself and ask for help to the experts. It is easy for us to use ice. Even if you are seeking medical help, ice the area immediately. Use an ice pack or slush bath of ice and water for 15 to 20 minutes each time, and repeat every 2 to 3 hours while you are awake for the first few days after the injury. Try to ice the areas as soon as possible after the injury and continue to ice it for 15 to 20 minutes. The next is compression. To help stop swelling, compress the area with an elastic bandage until the swelling stops. Don't wrap it too tightly or you may hinder circulation. Begin wrapping at the end farthest from your heart. Loosen the wrap if the pain increases. And if the swelling is still occurring, then you can go to your doctor to ask a prescription for the right medicine for you to take.
Shoulder dislocation is a type of injury that may cause from motorcycle incidents or any contact sport such as basketball or football. This is the way of treating the injured person. Check to place if it is safe. After, assess the level of consciousness of the patient and call EMS or Emergency Medical Services. Then check the airway, breathing, blood circulation, and if there's any bleeding. After that, check the PMS, the pulse if it's still functioning, the motor if the patient can still move it, and sensory if he or she can feel the touch. After that, expose the injured part to see the condition of the shoulder. Put the sling to the most comfortable position of the patient. And apply the swat after putting the sling. After putting the sling and swat, checked again the PMS to know that it wasn't affected by knotting the sling to the patient. Lastly, always make sure that the patient is calm and your mind that help is coming.
Fractures is a broken bone caused by sudden force being applied to a bone. Here are treatments for fractures. Number 1. Do not move the injured part. Number 2. Stop bleeding if there is any. Number 3. If you have to move the person, immobilize the broken part by splinting.
Sprain injury are injuries where a ligament is stretched or torn within a joint. Pivoting outlets such as those involved in soccer, football, tennis, basketball, and volleyball are higher risk of sprain injury. I and my friends are playing volleyball, but sadly, in the middle of the game, one of my playmates got a sprain injury. To lessen the pain, we do the simple treatment. First, I place her leg to make her feel comfortable. And after that, check the injured area. After checking the injured area, use ice pack. Apply it immediately for 15 to 20 minutes and apply it every 2 to 3 hours. And then lastly, we do the compression. To help stop swelling, compress the ankle with elastic bandage and rest. Avoid activities that cause pain, swelling, or discomfort. And if the pain continue, you should go to the doctor and ask the correct medicine you should take. Here are some prescribed medicine for sprain injury, including the ibuprofen, naproxen sodium, acetaminophen, and the Tromel ointment. They are enough to manage the pain of sprain. But always remember, the best medicine is to be responsible.
And now, the question is, how to treat a patellar tendonitis or jumper's knee? So, first things first is we need a strap or the free wrap, and all we need to do is you take the strap, place it in your leg, and you are just gonna do about 4 times around your knee or in your lower leg. 1, 2, 3, and 4. When you've done around and 4 times, you just tear it off. And now, all you're gonna do is just wrap the band up. And so you keep pulling it up until you get to the area right between this big bone on your shin, and just right below your patella or kneecap, and you hold it right there, and this. That's it. What this does is it provides the comprehensive load on the patellar tendon, which minimizes the force that actually goes through that tendon. Is a great way to treat any knee pain or patellar tendonitis.
And those are the way to treat the sports injuries. I hope you've learned a lot so you would know how to treat and be a help to someone that needs. I am Jisoo with the girls saying thank you for watching.